Good morning, boys and girls. Today we're working on lesson 117. Let's go ahead and follow along. Look at part 1, first word. What is the underlined part? What word? Surgeon. Next word. What is the underlined part? What word? Uneducated. Next word. What is the underlined part? What word? Lecture. Next word. What is the underlined part? What word? Challenge. Next word. What is the underlined part? What word? Ignorance. Let's go ahead and look at part 2. That name is Ambroy Pear. What name? Ambroy Pear. Look at the next word. That name is Leonardo da Vinci. What name? Leonardo da Vinci. Next word. Intelligent. Next word. What word? Barber. Next word. What word? Conducted. Next word. What word? Spirits. Next word. What word? Popular. Next word. What word? Advice. Next word. What word? Ailment. Next word. What word? Penicillin. Next word. What word? Medicine. Next word. What word? Anesthetics. Next word. What word? Haircut. Next word. What word? Latin. Next word. What word? Respect. Next word. What word? Schooling. Next word. What word? Dissected. Next word. What word? Anatomy. Next word. What word? Infected. Next word. What word? Unfortunately. Next word. What word? Warfare. Next word. What word? Physician. Next word. What word? Frequent. Next word. What word? Lanced. Next word. What word? Purify. Next word. What word? Muscles. Let's go ahead and continue to part 3. We're going to talk about what those words mean. Number 1. What word? Wounds. A wound is a cut or an injury. Next word. What word? Sluggish. Sluggish means slow. Everybody, what's another way of saying the slow traffic? Get ready. The sluggish traffic. Touch word number 3. What word? Amputate. What does the surgeon do when amputating an arm or a leg? A surgeon cuts off the arm or a leg. Look at word number 4. What word? Scalding. Scalding water is so hot it could burn you. Everybody, what's another way of saying the water is so hot it could burn you? Get ready. The water is scalding. Touch word number 5. What word? Ignorant. What does ignorant mean? Ignorant means unaware or uninformed. Everybody touch word number 6. What word? Suspicious. Now, if you are suspicious of someone, you don't trust that person. If you don't trust salespeople, how do you feel about them? Get ready. You're suspicious of them. Now let's go ahead and look at part number 4. We are beginning with our story. Make sure we follow along. Pay close attention. Now, the barber surgeon. Around the year 1500, there were 3 types of doctors. The 3 types were called surgeons of the long rope, physicians, and barber surgeons. The surgeons of the long rope, unlike the surgeons of today, never operated. They dressed wounds, gave out pills or drugs, and bled people. During the 1500s, people believed that some diseases were caused by blood that was sluggish. The surgeons of the long robe suggested that patients would recover from diseases if some blood were removed from their systems. Now, let's listen to question number 1. How were surgeons of the long robe different from surgeons of today? So, surgeons of the long robe never operated on people, but surgeons from today do operate on people. Now, why did surgeons of the long robe bleed patients? Surgeons of the long robe bled patients because they thought disease was caused by sluggish blood. Let's go ahead and continue. Sometimes the surgeons of the long robe worked with physicians. Physicians did not do any work on patients. They lectured at universities and gave advice to people who could afford to hire them. If a patient needed some kind of care, the physician would bring in a surgeon of the long robe. The physician would give the advice, and the surgeon of the long robe would take care of the patient's ailment. The physician never touched the patient. Both physicians and surgeons of the long robe went through a great deal of schooling. They spoke Latin, and the books they read were written in Latin. The great majority of the people of the time could not speak or read Latin. In fact, most of them couldn't read at all. Physicians and surgeons of the long robe were well-to-do and highly respected, even though they knew very little about medicine by modern standards. Listen to question number 2. What kind of work did physicians do? So physicians lectured and gave advice. Who touched the patients? The surgeon of the long robe would touch the patients. What language did physicians and surgeons speak and read? Physicians and surgeons spoke and read Latin. Now let's continue reading. The third type of doctor was the barber surgeon. Most of the barber surgeons were uneducated, even unable to read. Many had other jobs, such as tending pigs or cutting meat in a market. Most people had little respect for the barber surgeons, who had learned their trade by working in a barber shop. You could get a lot more than a haircut in those barber shops. You could also get a wounded leg amputated or have a boil lanced. You could have your teeth pulled or a bullet removed. Guns were just coming into use in warfare around this time. Listen to question number 3. What was the third kind of doctor? The third kind of doctor is the barber surgeon. What kind of work was done in a barber shop? In a barber shop, legs were amputated, boils were lanced, teeth were pulled, and bullets were removed. Let's go ahead and keep reading. Barber surgeons usually had a number of charms hanging in different parts of their shops. One of the most popular charms was a stuffed animal that was hung from the ceiling. The animal was supposed to keep the evil spirits away while the barber amputated a leg or an arm. Amputations were frequent because the doctors didn't know how to stop infections. They had no penicillin or other drugs of that type, and they didn't realize that wounds should be kept clean. When a wound became seriously infected, the patient would either wait to die from the infection or have the infected part amputated. The operation was conducted without any anesthetics because at that time anesthetics were unknown. The barber surgeon would tie the patient to a chair and saw off the infected part. Then he would place scalding hot oil on the wound to stop the bleeding and to purify the wound. If the bleeding did not kill the patient, the scalding hot oil sometimes did. Listen to question number 4. Why were so many amputations performed? There were a lot of amputations performed because the doctors did not know how to stop infections. How were amputations performed? Amputations were performed by tying down the patient. The infected limb was amputated and boiling oil was put on top of the wound to stop the bleeding. Although the barber surgeons were not trained in science of medicine, their knowledge was not much less than of the physicians and the surgeons of the long robe. The surgeons of the long robe never operated because they knew that the patients would probably die from the operation. So they devoted their efforts to impressing people by speaking in Latin, blaming diseases on evil spirits, and attempting cures that did not work. Listen to question number 5. Why did surgeons of the long robe never operate? Surgeons of the long robe did not operate because they knew that the patient would probably die from the operation. What did surgeons of the long robe do? So surgeons of the long robe impressed people by speaking Latin. They blamed evil spirits and attempted cures that did not work. The religious ideas of the times made it very difficult for doctors to find the cures that did work. People believed that a person would not reach heaven if the body were cut into pieces. It was therefore considered a crime for doctors to study dead bodies. The doctors knew very little about the parts of the body, the muscles, the bones, the nerves, and they were prevented from finding out any facts by studying dead bodies. In studying anatomy, which is the structure of the body, they were allowed to operate only on animals such as dogs or goats. Unfortunately, the human body is not the same as the body of a dog or a goat. So the physicians and surgeons remained ignorant about the human body, and they were suspicious of anyone who tried to challenge their ignorance. Listen to question number 6. Why was it a crime for doctors to study dead bodies? It was a crime for doctors to study dead bodies because people believed that a person would not reach heaven if the body were cut into pieces. How did doctors try to find out about anatomy? Doctors found out about anatomy by operating on animals. There were a few challenges around 1500. One came from a famous artist, Leonardo da Vinci. Another came from a man named Ambroise Paré, who became a surgeon of the long robe. Even though he did not go to a university, he began as a barber surgeon and never learned to speak or read Latin. Both Da Vinci and Paré learned a great deal because they sought the facts, not the beliefs that had been passed along for hundreds of years. After we're done, make sure we complete our lesson 117. Answer all of those questions, please. Thank you, boys and girls. Have a great day.